Good afternoon. I'd like to call to order the Hamilton County Board of County Commissioners meeting of February the 23rd, our staff meeting. Good afternoon, Madam Commissioners.
Good afternoon.
Good afternoon.
Well, we have a couple very important items today to discuss. We have our commissioner, Health Commissioner Greg Kesterman is here. He was not really due until next week, but as we need him and duty calls, I'm sure that he will answer that call as he has today. So good afternoon, Commissioner, and we'd like to hear some information from you as it relates to, well, I'll let you get started on some of the newness of what's going on in Hamilton County. Thank you.
Great, thanks for having me, Commissioner. And I'll run through some of the slides that you're familiar with seeing, and happy to take any questions. Feel free to interrupt at any time. Right now with COVID-19 in our community, we are continuing to see lots of positive trends. I think probably the one item I want to caution as we look at the rest of the slides, which have pretty much all favorable trends. The one item I want to remind people is that there still is a lot of COVID in our community. Today, we have about 72,246 cases since the onset of this pandemic, of which 67,000 cases have recovered. That leaves 5,300 active cases of COVID within our community. So please continue to remember it's important to be cautious when you're out and about. There is still COVID present. I know a lot of things feel hopeful, but sometimes when you have that hope, it's easy to forget there still is COVID. So just a friendly reminder. Looking at our cases, we are continuing to see a nice downward trend, even in the last week since I presented to the county commissioners. We are at 170 cases per day, which is down from about 200 cases per day when I met with you last week. So very positive sign. We did have one day with a significant number of cases. That was on Saturday. I think that was really just a data reporting issue delay in some of the data coming into the health department. Case positivity rates continue to decline. Today for Hamilton County as a whole, we are at 8.8% approximately. We do continue to see slightly higher positivity rates in the suburbs when compared to the city of Cincinnati. Similarly, we are continuing to see our reproductive number come down. That little day from Saturday did cause our reproductive number to jump just slightly, but it still remains below 1. Today, it's at 0.89. Another positive trend is our hospitalizations. These are at around 300 today. You can tell we have had significant relief from where we were at in early December through January when we were closer to 800 cases per day. The same trend is holding true within our intensive care units. Today, for the first time, we are below 100 cases within our region's intensive care units. And only about 60 of the 90 individuals in the ICU are on ventilators. So continuing to see some forward progress, and these are great news. This is great news for our hospital systems, who are certainly experiencing relief and able to get back to a much more normal staffing level. So great trends all around. Yesterday, our office did issue a press release related to the UK variant, B117 lineage, which was found here in the state of Ohio. This was found in Hamilton County, as well as 6 other counties, or a total of 6 counties statewide for 11 total cases. I know Cuyahoga had four cases in their county this week as well. There really is no new concern. You have heard me say many times that it's not a matter of if we see a variant here, it's just a matter of when. And the reason we know that, the reason why it's important to know, it brings more awareness to our community. The variant isn't necessarily more dangerous, but it does spread a little bit faster. And so it's just important for us to continue to practice those things that I've been talking about throughout the pandemic, which include wearing your mask, socially distancing, washing your hands, and keeping sick at home. If we do those things, we'll continue to see our cases trend in the correct direction. And so there still can be a lot of hope, and there's really no need to change our direction at this time. Lots of stuff last week with snow. When I reported to the commission last week, we had scheduled had to reschedule 775 appointments from the beginning of the week. Those all happened Friday of last week, Monday of this week without any issue. In addition, because of the snow, the 2 manufacturers of vaccine were not shipping to Ohio. And so on Friday, I made a frantic call to the Ohio Department of Health, who was able to provide me 500 doses of vaccine, and we're able to continue Friday's clinics without issue. So really a lot of great work from many, many partners to make sure that all of us statewide are able to continue this monumental task of vaccinating our public. This week in Hamilton County, we are seeing a lot more vaccine at the health department than we've seen in previous weeks. My office is getting about 2,300 doses of vaccine this week that has already been received, and we have clinics scheduled throughout Hamilton County. We are taking vaccine directly to a couple churches within our community, including today we are at Lincoln Heights Missionary Baptist Church. And on Thursday, we are at the Word of Deliverance. And, you have heard me say many times throughout this pandemic, as early as February, that as an agency, we must continue to be flexible and adjust and make shifts as we need to. I appreciated the phone call this week from Bishop Hilton, letting me know that some of the scheduling at Word of Deliverance was a little frustrating. People were trying to call the phone and it was putting them on hold and dropping phone calls. And it's this type of feedback that we're able to take and improve our processes. So we have made some adjustments to help make sure that that doesn't happen again. And we're able to continue to get out into the community with nearly 2,300 doses, as I mentioned this week. When you look at Hamilton County as a whole, we are trending above the state right now with regards to the number of those vaccinated. The state has vaccinated about 12.4% of the total population. Here in Hamilton County, we've done about 13.16% of the total population. So that translates out to be about 108,000 residents in Hamilton County have received their first dose of vaccine. Second doses were a little bit behind. Realize those are 3 or 4 weeks after your first dose. We have successfully completed vaccination on 6% of the total population in Hamilton County. The good news, though, is you do receive benefits. You do receive some immunity after that first dose of vaccine. So we do have a decent number of people that are starting to play a part in reducing the spread of COVID-19 as a result of vaccine. Last item that I'll report on deals with the Ohio Alert System. This week, we still have 2 items that are marked as flagged. We have indicator 1 and indicator 3. Normally, if you only had 2 items, you would transition to orange. Unfortunately, because indicator 1 is above 100 cases per 100,000, we have to stay red until that drops below that threshold. So with cases continuing to decline, I suspect in the next few weeks, we might be able to transition back to orange. So that's good news as well. I will stop there and happily take any questions that you may have of me. Commissioner, you are muted.
Muted.
Thank you. Thank you, Greg, Health Commissioner. The one reason why, if I could, Madam Commissioners, just interject at the beginning that we wanted Greg to come. I know he'll be also at the briefing on Wednesday, is really Word of Deliverance was one, but there were other churches that were also involved where there was a bottleneck. I think Corinthian may be this week also. Greg, you can correct me, who will be giving out vaccinations. So it was not just the one church, it was other churches. I was actually on for 3 hours waiting. That bottleneck that we all talk about. So one question that I had is the city also using the same people that are picking up the line for the county, or are they, do we have our own team?
No, these are my employees. They're actually contact tracers that we've repurposed to helping us with the phone calls.
Okay.
What we found out after several conversations is probably we should have only scheduled one church at a time to go to our call center, and that might have helped eliminate some of the bottleneck. The other tool that we have, and we're going to try and transition, if we could have a list of individuals and phone numbers, we can call them as opposed to them ever having to go on hold at one of our call centers, meaning it would be better for us to call you as opposed to putting you on a hold line.
Okay. So that's a new strategy you're going to use. And
that's right.
Yeah, that may be very helpful. I'll open it up to our other commissioners, Vice President Reese.
Yes, thank you. Thank you for having having us talk today about the UK variant, because certainly, you hear that, you see it, A lot of people read about this and people get very concerned and nervous. My question, I know that you said we shouldn't be concerned about it, but I want to make sure that people understand the vaccine that we have now, does that work against this second, this UK variant?
Yeah, everything that we have seen, at least from the science thus far, is basically telling us that the tools that we have in place now are effective against the variant. And that does include the standard isolation period that we use for COVID-19. And it is believed that the vaccine will be equally effective against the variant as it is on the more normal strain of COVID-19.
Okay, and the second issue is we've been hearing about asking people to wear 2 masks now. Is that what we're doing? Is it 2 masks or is 1 mask still sufficient? Because we've been having a lot of questions about that.
I think the better the mask that you have, the better off you are. We have certainly seen a lot of folks incorrectly wear their mask with their nose hanging out. That is the least effective. If you have a mask and it has one of the metal cinch pins and you're able to clasp it around your nose, I think you're the best protected. And then certainly the more thick mask, the better it's tight against your face, the better off you'll be. I think where there is some misconception is if you throw on 2 masks, but yet there's some pretty big air gaps, it really doesn't improve the effectiveness of the mask. But overall, the tighter fitting mask, if you can accomplish that with 1 mask or 2 masks, I think you're in better shape. The same thing holds true. I've heard a lot of talk throughout the pandemic about these N95 masks and how effective they are. But for somebody like myself with a beard, an N95 mask does no better than one of these cloth masks because the air can escape out throughout my beard. N95 masks are specially designed to be fitted to a face, and they actually do a test to make sure that they don't leak. And so any of our physicians that actually wear those are specially fitted for their N95. So overall, I know that was a long-winded answer for the question, but overall, I think the most important thing people can do is be aware of how closely their mask is fitting to their face. I think that would put us in the best shape possible.
And did you have to alert the CDC, or are you in conversations with them with this new variant now? Is the CDC involved, or how does that work?
So the way the variants work in the state of Ohio, when a lab notices an irregularity in the lab test, it sends the result to the Ohio Department of Health. And in instances where ODH believes that the sample is appropriate, they send it to the CDC to analyze. And that is where we get back the notification which type of variant it is.
Yeah. And the last thing, I just want to thank you. I think it was about 2 weeks ago now, we had a virtual town hall with the governor on it. And one of the questions was, how do we help with the racial equity? And he had indicated if there was a church that wanted to do it, he was going to get some more vaccine available, but to contact you to have that done. And so I'm very happy to see not only our county health department, but also City of Cincinnati Health Department. Obviously, they're the ones doing Corinthian, and thankful that we have some additional vaccines so that we can have it through the African American churches. So I do want to commend you on that and thank you for that. That is happening.
Thank you very much. And that extra vaccine is critical. When I'm only getting 500 doses a week, my power to go into the communities is minimalized. So having 2,300 doses this week is really helping us a lot. So we're happy to be in the community, and we're happy to be out there getting the vaccine where it's needed.
Thank you.
Thank you. Commissioner Dreehouse.
Yeah, thank you. I was going to comment on the equity issue as well. So as you all know, we did submit a plan with the city and the health collaborative and the hospital systems to try to encourage the governor, as more doses become available, to make them available to public health, because the mission of public health is one of making sure that equitable distribution happens throughout the city or the county, depending on the health district. And so yesterday, also there was, as both of you know, a call with the County Commissioners Association and the governor. And so we coordinated an effort for all of the metro counties to get their plans also to the governor, just to kind of put a finer point on it, that we are working really hard related to the issue of equity. Not only are we committed to it, we're capable of delivering on the equity, unlike some of the other systems that just aren't set up to be safety net systems. And so the strategy seems to be working so far. So that's the good news. And Greg and Melba Moore, the Cincinnati Health Commissioner, were critical to these efforts. And so I too want to thank you, Greg, for playing your part there and making sure that the governor clearly understood what the equity plan for Hamilton County looks like. So I applaud you for that. And we look forward to getting more vaccines as they become available to the county as a whole.
Thank you very much.
Thank you. And thanks, Commissioner, for coming forward. And so the fact we just keep getting more vaccines, that would be awesome. So I know our advocacy, as was said earlier, has truly helped to get more numbers in. So thank you again for coming forward.
Thank you very much. Have a good afternoon, Commissioners.
You too.
Greg.
So we have another interesting and important item. Item number 2 is JFS and Women Helping Women, the expansion of DIVERT program, which is Domestic Violence Emergency Response Team. So we have Tim is on and we have Laura. And so Tim, are you going to take the lead on that?
Yes, good afternoon, Commissioners. Thank you very much.
Afternoon.
Not sure my camera is working. It's on, but I can't see myself, so.
We can't see you, which might be good, huh, Tim?
Yeah, probably to your benefit. My wife would agree. Thank you so much for having us here today. Really excited to talk to you about another great partnership that will allow for an expansion of the existing DIVERT program that partners with local law enforcement to help survivors of domestic violence. The program's operated by Women Helping Women in conjunction with law enforcement. There's a real but sad linkage between child safety and incidents of domestic violence. They're often witnessed by children or in households that have children. That linkage, obviously, unfortunately, can lead to trauma for the children and the family as a whole. The pandemic has not been helpful in that way. It's only amplified the issue for both. Additional stressors brought on by the pandemic for families can lead to increased child abuse, domestic violence. All those sorts of things are hand in hand. With that in mind, JFS is proud to be able to support this overdue expansion into neighborhoods in the county that experience some of the greatest incidents of domestic violence. This partnership's coupled with a JFS partnership that's been in place for about the last 10 years with the YWCA and their Safe and Together program. It demonstrates collaboration with community partners to serve families experiencing partner violence, and it's a national evidence-based program. The program also supports, Commissioners, your declaration of racism as a public health crisis. As you know, sadly, survivors of domestic violence are predominantly persons of color and predominantly women of color. And Kristen, who will make the presentation here in a little bit, will go, I think, more into that. And I think, Jeff, this program evolved out of a recommendation from the Women and Girls Commission several years ago. So we are just really excited, and special thanks to Holly Chrisman, who really helped us get this program up and running. With me today is Laura Wolf and Margie Weaver, and they're important and will be around to answer questions. But most importantly, with us we have Kristen Shrimplin, who's the president and CEO of Women Helping Women, Amy Bressler, who is their Director of Services, and Wayne Williams, who is the DIVERT Program Coordinator. So welcome, you guys, and the floor is yours.
Thank you so much. And Tim, I think you probably just did a great job for our presentation, so I'll try to build on that a bit. Thank you, Commissioners, for your time. And just before we go into the slide deck, which Amy will share, and we'll keep this concise. here's the top line, right? Our region is dealing with the intersection of 3 public health epidemics: COVID, as was just reviewed, institutionalized racism, and gender-based violence. And that absolutely necessitates public health epidemics, public health solutions, right? That's where collaboration, whether it's with law enforcement, policymakers, funders, corporations, the courts, healthcare, is so critical. And that's why we feel really good for the key takeaway that I want you to hear after we're done with the slide deck. DIVERT works. It is evidence-based. It's quick on-scene response, and we are addressing survivors who've been disconnected from resources. So as we talk about equity, you cannot have equity without safety.
Mhm.
And so we'll go later on into the demographics of what we're seeing with overrepresentation of who's consistently being victimized, because frankly, the systems aren't showing up at the best way that we all can. So Amy, if you could share the screen. So I just want to go through some nuts and bolts of what is the DIVERT program. So it is a 24/7, 365 days, 3-tier response that is trauma informed. And we partner with local law enforcement for that collaborative process for domestic violence survivors. And that's key, right? That's the game changer here. Survivors are getting met on scene. And so once we're on scene, we immediately work with the survivor on specialized safety plans customized to their needs. We provide on-scene advocacy and education on the legal process. But then we don't stop there. We have wraparound services of everything that we're doing at the agency to connect them to more support and empowerment. We can go to the next slide. And so in really thinking through, okay, how does this work? So officers respond to a 911 call. Officer shows up for domestic violence. They secure the scene. They then call us. We've got police radios, and they request us, and we show up on scene. Our protocol is that we've got to get there within 25 minutes or less with our response. So Women Helping Women, we're not about bricks and mortar. We are absolutely about getting out into the community. Next slide, please. So after we show up on scene, we do the safety plans, we get folks Lyft rides, we try to locate them into safe shelter, safe hotels, work with emergency services. But then there's so much work that has to happen the following day and the days thereafter. We connect them to so many of our resources and notification of the legal system. It's overwhelming. It's a lot to walk through. So we want to walk that pathway with survivors. Ongoing safety plan. Gender-based violence isn't about a one-time, it's a pattern. So there is ongoing safety planning that's happening. And then this connection, and that's key. You'll find out later why that's so key. We have to connect people to resources, whether that's relocation, civil protection orders, going through court, support groups, crisis intervention. And then we also have, in addition to our DIVERT advocates, we have in-house law enforcement advocates daily going through police reports. And so this is hard for you to read the fine print here, but this basically says after that DIVERT advocate is on scene, then what does that connection look like to more resources and support, whether it's from our agency or the community? Right, so that goes back to public health epidemic. We need a public health solution. We've got to work in hand, cross-sector support, so that survivors aren't left to fall through the cracks. So, a lot of these high points really are court advocacy, criminal justice process info, support groups, police assistance, emergency services, victims of crime notification, legal assistance, and working with so many social service providers. And I want to kind of take a quick snapshot here, because this will kind of set the stage for our strategy. So gender-based violence impacts every single type of person. And it is, as a public health epidemic, rampant in Hamilton County. And we are strategic. We know from working with our existing law enforcement partners and getting those police reports where some of the highest rates of domestic violence is occurring. And that's how we want to be strategic and really focus on areas of need. And that's the way we've been doing it and where we really need to increase. So I want to talk for a moment, who do we serve? Since we have launched in 2018, where we first started with Cincinnati Police Department, we have served just with Divert over 3,000 survivors. And we also are in a 5-year longitudinal study with the University of Cincinnati. And here's what the research is telling us. 70%, over 70% of the survivors we show up on scene with have never interacted with an advocate. They're disconnected from resources. And so there's a lot of reasons for that systemic disconnection, in addition to the nature of gender-based violence. It's power and control and isolation. 62% of our survivors, they've got no income. They don't, financial self-sufficiency is just a real stretch here. They're making $10,000 annually, or more likely than not, zero income. Overwhelmingly, who is experiencing domestic violence? Individuals who identify as female. We have real concerns around what is happening around younger women, 30%, 37% between the ages of 20 and 33. And here's the spot where we have to lift up with equity. 67% of the survivors that we're responding to on scene are identifying as African American, as well as additional people of color. And think about the survivors we're showing up to. The majority have been disconnected and have never had an advocate before. That's part of the game-changing part around this with collaboration. And this, I want to take a moment because this slide concerns me. And I know I've had enough conversations. Our agency has talked with so many people in this region. This concerns all of us. What is actually happening to survivors? Just, top level, 50% of the survivors we respond to on scene have experienced strangulation at the time of victimization. 36% report a threat or an actual use of weapon, gun or knife, and 80% report that the perpetrator has threatened to kill them or themselves. So this is really why we know we're at the tip of the iceberg, right? Since 2018, we've served 300 survivors through Divert. We know annually from Hamilton County Sheriff Department, there's about 10,000 911 calls for domestic violence. People getting connected to safety and help should not be dependent upon their zip code. Should not. And so this is why we have to engage with more survivors. We have to continue expansion. We're so grateful for the partnerships that have been developing. At this point in time, we've got 6 additional jurisdictions who've agreed to partner. And we really have our sights on, think back, to part of the map with the zones around 10 to 15. And here's a cost benefit analysis. No additional cost to jurisdictions that are willing to partner. Law enforcement don't have the financial bandwidth for our services. So again, we're really grateful for all the diversified support we get. And then the last slide, what does expansion look like? Remember, we're a 24/7, 365-day unit. So we need to expand that 1 zone to 3-zone coverage. That means each zone has 37 shifts. In each of those shifts, we've got like a 3-tier response with 3 advocates deep. This strategically allows us, when we get the call, we show up on scene and we do our job and we work in partnership with law enforcement to really hopefully we've got to get to the other side of this. And we can't have 50% of people experiencing strangulation. And what we saw last year, too many residents in our county have lost their lives. So we're grateful to focus on expansion, and we must continue. And I will stop there and welcome the team in for any questions from anyone.
Okay, thank you so much for your presentation, very concise and comprehensive. And I'm actually going to open it up to Commissioner Dreehouse first, since you were here at the foundation of this before I even came in, if you'd like to say a few words.
Yeah, thank you. Thanks to the team for being here. Really appreciate it. Yeah, this was a recommendation that came from the Commission on Women and Girls. The board embraced the idea, and then we worked to figure out how we would implement it. And so this is a bit of a pilot. I mean, this is the first time we've done this. The city beat us on this one. They had the Divert program, I think, a couple years before us. But we asked Kristen and her team to identify the communities where the need was the greatest, where they were seeing the most victimization, and then focus on those areas with the response. So some of this is COVID dollars, because as Kristen just alluded to, we saw a significant increase, as we've talked about at previous commission meetings, during COVID because of the isolation. Some CARES dollars were used here, and then some general fund dollars were used here. So from my vantage point, this is a pilot program that will likely expand in the future, because I think, as we've just heard, the need is everywhere, but there are certain parts of this community that see an increased need. And so that's what we've targeted on. So Kristen, I didn't hear you detail the communities that we are targeting, and I would appreciate it if you could do that related to that county map that you showed.
Mm-hmm.
Absolutely. And I would welcome in Wayne, who is our Divert Director and has been working hard with all law enforcement on those partnerships.
Hello, everybody. My name is Wayne Williams, and I'm the Divert Program Director. So I kind of laid out a timeline here. So the current jurisdictions that we are currently partnering with is the City of Cincinnati, Norwood, Cheviot, Green Township, and Delhi. We will be expanding to additional jurisdictions on top of that. And those jurisdictions will be Mount Healthy, St. Bernard, Lincoln Heights, Green Hills, Forest Park, and I believe that is it. I'm still in the process of getting meetings together with Arlington Heights and Reading Chief, Springfield Township Chief. I'm still trying to get a meeting with him, as well as Coleraine Chief and Madeira. So I'm still in the process of getting some meetings together with them to talk about the Divert program and to discuss a possible expansion within their jurisdiction.
Mm-hmm.
Can I ask one follow-up, Madam President?
Yeah, sure. Go ahead.
Thank you. So when you reach out to these jurisdictions, some of them are policed by sheriff deputies, and some of them are policed by local law enforcement. And so what is that dynamic like? And I'm wondering, what that partnership looks like, and because you've got a diversity of communities there.
Yeah, so it's really just about, so when I reach out to the chiefs, the conversation, the selling point is it costs $0 from them. So they love hearing that. And then the other selling point is really, we here to serve their communities. We here to partnership with your officers to make sure that the community you are serving is getting the help that they need. So I haven't really came across many barriers. It's really been great. The only barriers that I have came across is obviously trying to secure meetings, because there's been obviously COVID and there's a lot of things that's going on. So actually trying to secure meetings and sit down and discuss Divert more thoroughly. But there hasn't really been any barriers. They've really been on board and excited, and they ready for us to expand to their jurisdiction.
Great.
And with the sheriff department, yeah, they have been very, very welcoming. And we are kind of discussing possible other jurisdictions that they serve, because there's a total of 4 districts of the sheriff department. So I'm discussing possible ways of us trying to serve the whole entire sheriff department.
That's great. Thank you.
You're welcome. I had a question though. I'm a little confused, Christian, as we talk about the demographics and the African Americans that are impacted by domestic violence. And then I hear the Norwood, Cheviot, Green Township, and Delhi. And I also heard there would be an expansion to Mount Healthy, Lincoln Heights, and Forest Park. And I guess my confusion is, why did we not start in those predominantly Black areas? I don't mean, we can do both, but to need an, I just am missing something.
No, it's a great question, Commissioner. Our agency is really dependent upon where we can start, where we have really good relationships, where law enforcement are willing to have this conversation with us. It's definitely been a work in progress. And I think that's why when we first piloted it at the agency, where we had seed money from the Ohio Attorney General's office, the focus was Cincinnati and the 52 neighborhoods in all 5 districts. Because when we look at survivors we serve, we know a huge amount of our survivors, and frankly, Black and brown female survivors are coming from 52 neighborhoods in Cincinnati. So we started there. Other jurisdictions started hearing about us, and law enforcement talked to law enforcement. So we were able to bring on some additional, like North College Hill and others. We absolutely know where we need to make more of a lift. We have all the data in knowing, we're just with the, we served last year, and we actually went down in some numbers, about 7,500 survivors because of survivor access with COVID. The year before was about 8,600 survivors. So we absolutely know from our data which neighborhoods we need to turn the light on to divert response. It's a lot of relationship building that just needs to keep occurring.
Thank you. And so I'm even more in support of the expansion money to be able to go to those areas that we talked about. Vice President Reese, do you have any comments or questions?
Yes, thank you. Thank you, Madam President. Yeah, just following up on, first of all, thank you for the work that you're doing and for this presentation. But I do want to follow back up on President Dumas's question, and just so I can get an understanding. So initially, Cincinnati, if I'm not mistaken, Cincinnati had this program before the county, right? Or no?
Correct. They partnered with us. We launched it with CPD because we already had about a 20-year partnership with them.
Gotcha. No, I understand that. And then the county came in with an expansion component of this. And I think Commissioner Driehaus outlined it. We had some CARES Act money and some other money. And I guess just going back to that, out of this list, the majority African Americans, the largest will be the city of Cincinnati, which was already in a partnership. But our expansion, already that we've, I guess, paid for, that expansion didn't really target the big hot spots for African Americans. Like you said, Norwood, Cheviot, Green Township, and Delhi. Now this new expansion, is this something that will be covered in what we've already paid for? The ones that you're going into Mount Healthy, Lincoln Heights, Forest Park, Green Hills, and St. Bernard? Or is this something that will be a new piece? Is this covered in what we've already, I guess, funded?
Really good question. Divert is underfunded. So each zone takes us with full cost a little over 400,000. So what we've been doing with Cincinnati, Women Helping Women, we've been dipping into our private reserves to fund this. The city had never previously funded it. However, last year, and it became active this year, City Council did agree to provide funding for parts of our response. And so then as we were also working with some of those additional jurisdictions, we would get some funding from the Victims of Crime Act, but it wasn't covering it. We dipped into our private donations because we really believe in this. And so then also working really closely with Hamilton County, what is the opportunity so that we can get it out to more, and strategically where we are seeing the highest rates of DV. I would love, and I would be really happy to have follow-up meetings to talk about how can we leverage going to a yes in some of the jurisdictions we've tried to get into. We have some real thoughts around that, and I think would love to have some further support in the room. But yes, to be clear, the contract, that we're engaging with through Hamilton County does not pay for all the services. So it's not a repeat payment of what's in Cincinnati.
Yes, no, I appreciate that. I just was piggying back on your presentation, was very strong at the beginning when you talked about the numbers of Black and Brown people. And I just thought kind of the same as I guess President Dumas had brought up, said, wait a minute, that seemed like the expansion would have the higher numbers of African Americans in terms of population. I don't know in terms of situations. And then I would just throw out, obviously, Silverton and Woodlawn are also areas that in terms of population, I don't know in terms of incidents. So yeah, I just glad to hear about this, and certainly looking forward to learning more. Thank you.
Thank you so much.
Thank you. And Christian, as we talk about trying to collaborate more with our public safety officers, Sheriff McGuffey, there are a lot of sheriffs, like in Lincoln Heights, there's a sheriff department. So I would think connecting with her also would be very, very helpful. And also being a survivor and advocate for domestic violence, and also a speaker for domestic violence, I am so excited about what you're doing now. I was excited when I first heard it, even more excited now. So thank you so much for all the work that you do. All of you do.
President, we appreciate it. Thank you, everyone.
Okay, thank you very much. Thank you all for coming.
Right. Commissioner Dumas, I did want to state that on Thursday, you will have a contract in front of you where JFS is helping support some of the expansion, and we'll be using levy dollars in that contract to support the expansion. Obviously not for the entire county, but at least the next phase of that expansion.
Okay, thank you, Laura.
Thanks, Laura.
Okay, so we have in front of us actually 3 executive sessions, and I'm going to read them. Our first executive session pursuant to RC section 121.22 G4 regarding collective bargaining. Our next executive session is pursuant to RC section 121.22 G2 to consider the sale of property at competitive bidding or the sale or other disposition of unneeded or unfit for use property. And the third executive session is pursuant to RC section 121.22 G3 to conduct a conference with an attorney to discuss pending litigation. I'd like to make a motion to go into executive session.
Second.
Commissioner Summer Dumas,
Yes.
Commissioner Reese,
Yes.
Commissioner Dreehouse.
Yes.
Thank you.